Stepped-up precautions to prevent the spread of the coronavirus define the week. From the World Health Organization declaring it a global pandemic to the U.S. announcing travel restrictions from Europe, Arizona also declared a state of emergency as it confirmed several more cases in a matter of days. We learned more about the precautions health officials in Pima County recommend from Chief Medical Officer Francisco Garcia. Where is personal responsibility in this? I mean, we hear so much about if you're sick, stay home, don't shake hands. How long is this going to continue for, and what's our role in tamping this down?
I really think that is where we really have an opportunity here. And as we lean into this next phase of the response, really what the health department is saying and what Pima County is saying is that we each need to put our own oxygen masks on first before we put it on our seatmates, to borrow an analogy from the airline industry. So what does that look like? Well, that looks like making sure that we're staying home if we're sick. Culturally, that may be a big shift depending on the profession, but we need to figure out how to make that happen because it's clear that when folks are symptomatic and they're sneezing and coughing and around other folks, that's when infection is going to occur. This virus is spread by droplets that we produce when we sneeze and we cough, and they touch the person in front of us. So that we need to make sure that that's not happening. So if someone has a fever, shortness of breath, cough, sneezing, they need to stay home, and they need to stay home until they're asymptomatic.
If someone does have those symptoms, do they call the CDC? Do they go to their primary? What about these tests that we understand are not easy to get?
So no, the short answer, right? So you do what you would have done 2 months ago. So 2 months ago, if I would have had a bad cold, I would have stayed home for a couple of days. I probably wouldn't have called my doctor. I probably would have taken some Tylenol if I was having a headache or if I was having fever, and I would have stayed home. That's what we need to do. Most of these cases, 80% of these cases are really mild, so mild that they may even be subclinical, that they may not even pop up. And so those cases need to run their course, but they need to run their course not in the workplace. They need to run their course in our homes, right? So that's if you're sick, you're not going to take that opportunity to go to the movie theater. You're not going to take that opportunity to go to a crowded area. You're not going to go to a party if you're sick. Those are the kinds of personal responsibility things that I think are really, really key. Keeping ourselves healthy and keeping our families healthy.
It seems like the cases then, if you do have those symptoms, are not as serious. Are we overreacting then?
So overreaction is a loaded word. So I think that we need to put this in the context of what influenza does to our communities every year. The big difference here, and I think we're seeing magnitudes of death that are probably, when all is said and done, it's going to be like a very bad influenza season. However, there's the big wild card is we just don't know. This is a new virus. And I think that that's what's causing anxiety. And I think that that's what's causing misinformation. And you see that sometimes the federal government contradicting itself. And so I think that this is really important for us not to panic and for us to listen to trusted sources of information to make sure that that's where we're getting our best advice.
The CDC announced it would provide $11 million to the state of Arizona to help combat this virus. You're a physician. How do you think that kind of money is best spent given what we know now?
So I think that testing capacity is definitely something that we have suffered from, right? So up until late last week, there was only the capacity to test about 300 people total in the entire state. That has improved significantly with new national laboratories coming on board and making testing available. So that's improving tremendously. But we need more lab capacity, and I think that that's one of the big things that we need. to be thinking about. I think as we plan for a sustained response, and I believe that we're in this for a few months, as we plan for a sustained response, there are real economic impacts to the things that are going on right now. When conferences get canceled, hotel rooms are vacant, people get sent home from their jobs, and I think that's a really, really important piece. And so I think some of it needs to sort of think about or address some of those concerns.
You mentioned this is a novel virus. This is something that's new to us. Every year, the flu kills tens of thousands of people throughout the world. Why is this one so different?
It's different because it's different because we haven't seen it before. The influenza and are things that we are comfortable with because we pop into our human ecosystem periodically, right? This is not something that we've seen before, and I think that that's where the source of panic is coming from. This virus is not that different. In fact, in some ways, for instance, in some ways it may be a tiny bit less scary. So for instance, I think that all the data is seeming to indicate that children are not particularly vulnerable. And so that makes schools really safe places, by and large, for children to congregate, because we know that the cases that have occurred in children have been from parental and household contacts. So I think that there are things that we still don't know about that, and that's what's making everybody's hair on fire.